Hi there. I am so glad that you've chosen to become part of the exciting profession of respiratory therapy. It is one of the most exciting health careers that's available today, and the future for this profession is extremely bright. A couple of things I think that's important for you to understand. One of those is that we're going to be changing quite a bit over the next decade. Throughout most of the history of the respiratory therapy profession, we've been directly involved in care of patients in the hospital setting. That's been our primary location of service, our primary site in which we've provided care. But that's going to change. We're going to be moving outside the hospital because the future of respiratory care and the future of health care is much more related to controlling the cost of health care. The hospital is the most expensive place in which respiratory or any health care can be delivered, and we've not to this point really treated the underlying problems that people with chronic pulmonary disease really are dealing with. We have treated flare-ups or exacerbations of those problems, but not the underlying problem, and that's where we're going to be changing. A couple of things that are important for you to understand about that is the skill set will be evolving. We'll still be involved in assessing patients. We'll still be involved in providing patients care through various types of respiratory therapy. But we're going to be much more involved in the education. We've done some teaching of patients in the hospital to help the patients get enough understanding so that they can know how they need to perform the therapies that are being done. In the future, a lot more of that is going to be helping patients self-manage their diseases. And this is going to require a couple changes. One of those changes is the ultimate degree or the ultimate education and training that you'll need is also going to be evolving. There are several things going on legislatively at the national level that will impact this. One of those is a minimum requirement to work in those roles outside the hospital of the registered respiratory therapist credential. So as you work your way through this program, it's important for you to understand that you really need to plan your education and how you accomplish your education to enable you to pass and to achieve that registered respiratory therapist credential. Second thing that's going to be required for you to assume those new roles is going to be a baccalaureate degree. That baccalaureate degree at the present time does not have to be in respiratory therapy, and largely that's because there aren't enough opportunities and enough programs for the number of people that need to achieve those degrees. So a degree in some area related to healthcare will qualify you to assume those new roles. You will be having opportunities to work in physicians' offices and medical clinics. You'll be having opportunities to work for insurance companies, health maintenance organizations, and other groups that pay for and therefore have a big stake in looking at the coordination of the quality of care that patients receive. We will be going to a continuum of care. Right now, as I said, most of the care is done in the hospital. When the patient leaves the hospital and perhaps goes for a short period of time to a long-term care facility or a skilled nursing facility, you're going to find that a whole separate team is now responsible for their care, and there's little or no coordination with the hospital from which they have just come. Ultimately, then, that individual may go home, and again, a third group of people, a third team, will be responsible for their care in the home setting. That cannot continue from a logistic or a financial standpoint. So that coordination is going to require that a respiratory therapist or group of respiratory therapists oversee the care of that patient and provide resources and information to that patient across that entire continuum. So it won't be three separate teams. It will be one team with different people assuming different roles in that process. Now, the hospital is still going to be an important piece of what we do in respiratory care, but it will only be the sickest patients and the patients needing the most assistance who are going to be in that setting.